HealthEdge Source can help health plans with their Medicare line of business by providing an accurate and automated solution to Medicare pricing. We are the experts in Medicare and have had over 25 years of experience providing solutions to health plans. Source offers configuration options that require no maintenance from a health plan. Even setup is minimal. The Source platform is updated every 2 weeks by the HealthEdge team with little to no disruption to your organization, which includes the most up-to-date information from CMS, including change requests, transmittals, updated fee schedules, yearly updates, and more. The entire Medicare program, including inpatient, outpatient, professional, and post-acute provider types, are all supported by HealthEdge Source. All of these provider types are updated and maintained by the HealthEdge team. Source includes payment policy edits to apply Medicare policies such as NCCI, MUE, modifier adjustments, and many more, along with reimbursement, to further drive accuracy and to help health plans cut down on the amount of vendors in their claims process by bringing reimbursement functions into a single platform. All of the pricing and editing in Source is fully flexible, so even health plans that are almost following Medicare but need a few modifications can benefit from using Source and easily meet the needs of their use case by simply turning policies off or adjusting the percentage of Medicare reimbursement. Once claims have processed in Source, the audit trail provides transparent results, making audits and provider inquiries simple. All the underlying data and rationale to pricing is provided to help health plans quickly answer questions surrounding Medicare rates, data, and policies. Source also includes solutions to assist with retroactive changes and repricing of claims, a repository of all of the underlying Medicare data, and even a solution to comply with the transparency and coverage rule,